I want you to imagine that I have a device that can deliver an extremely painful but not life-threatening electric shock to a stranger, to your employer, to a work colleague, to a sibling, to your friend, to a parent, to a life partner, and to a child, including a child in your care. And for each of those people, I would be asking you to rate how likely you would be to say to me, don't shock them, shock me in their place. I do this activity regularly when I'm delivering training as part of the care curriculum. What I do is I get the audience to indicate on their fingers on the scale from 0 to 100, where this is 0, this is 100, this is 20, this is 70. But I ask them to indicate how likely they are to swap places with each of those individuals I mentioned before. And then I average it out for the whole audience and come up with a percent. And what we find is the percent increases from a relatively low level where it's a complete stranger to a much higher level when it is a life partner, the parents of the audience, and it's almost invariably 100% if it's a child. And then I pose the question, what do we think is going on there? Why are we less likely to swap places with a person who we don't know, or even an employer, a work colleague, versus a friend, a sibling, parent, and a child, particularly a child in your care? And the answer has a lot to do with the closeness of connection that we feel to each of those people. Indeed, connection regulates behaviour at all ages. And this is a very important consideration to take in mind if you're caring for a child who is recovering from a tough start to life and is displaying behaviours that are of concern and that challenge you. At the very least, the most powerful way that you can achieve meaningful change in that child's life and some influence over the way they behave is to form a deep and lasting connection with them.